Minister. The government has made a lot of big announcements and big commitments over the last few months, and however these announcements and commitments are not being reflected by action on the ground. A case in point, again, is the announcement about testing. We've been told we're going to get 100,000 per week, then we've also told we're going to get 15,000 per day. And of course, this sounds great, but in practice, it's very different on the ground. I was contacted by a person recently who had to wait 22 days to get their test results, and that was after chasing up the hospital to get those results communicated to them. Others are waiting 12, 15 days to get the results. And I suppose testing figures seem very unclear and not very exact. And I'm just wondering how many results per day are communicated to those tested, because it would seem to be, it could be different. And it's probably a better way of measuring how effective testing is. Another big announcement was the state had done a deal with private hospitals. And of course, again, that sounded fantastic. The reality was different. I have been contacted by staff in private hospitals who have said their hospitals were significantly underutilised over the last 7 weeks, 8 weeks. And when you consider that almost 50% of those who have died from the COVID virus were resident in nursing homes, you have to ask yourself why the hospitals have been so underutilised over the last 8 weeks. One son of a nursing home resident contacted me, and he asked me, had the government abandoned the nursing homes? And unfortunately, the answer does feel like it's a yes. And so I suppose in that context, will the Minister commit to using all those resources in the private hospital to support nursing homes? And also, just home care workers are not required to wear masks, and it has been mentioned earlier on. And this is a real concern for many people who have vulnerable family members who are getting support. And it's also a concern for the home care workers. A home care worker may have to make up to 30 visits a day. And can the Minister ask why masks are not required for...
Need the time now for the Minister to respond if you want answers.
Yeah, I have 2 more brief points and then you can respond. And is that all right? Yeah. Pieta House do amazing work for mental health, and unfortunately, because of the postponement of the Darkness into Light walk, they are now down funding and need to cut jobs and frontline counselling service. So Pieta House have traditionally provided services where the HSE are weak. In order to ensure that the vital services Pieta offers are maintained and that jobs are protected, can the Minister intervene and work with Pieta to ensure that the vital services that Pieta House offers are maintained and sustained over the next few months and years? And the publication of Refreshed Vision for Change is now absolutely vital in order to develop a cohesive post-COVID-19 response plan for mental health. Will the Minister commit to the establishment of an implementation group for the Refreshed Vision for Change to develop a post-COVID-19 response plan for mental health? Thanks.
Could we stop the clock?